Good afternoon, everyone. I'm Cameron Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba, and I am once again joined, of course, by Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer. This is a big week in Manitoba. It is the return of students to the classroom. We wish everyone well today and throughout this week. Enormous efforts have been made to get students back to school, and we thank all Manitobans who have been part of those enormous efforts being made. I just want to say a few preliminary comments. I wanted to give an update on the pandemic response system that we put into effect only a few weeks ago. We believe that that system is working, providing Manitobans with good information. That information on a more specific basis is allowing system leaders to make decisions of how to restrict those areas that need further restrictions, and we're taking that differential approach in order to get people back to work and back to their normal lives as much as that is possible during this time. I want to indicate that there have been website updates that are ongoing. At this point in time, Manitobans will find a few changes, including the fact that we have an overview of the current guidelines in Manitoba that is easy to navigate to. So the same detail that was there previously remains, but there's a good overview section where you can quickly find key information in the province of Manitoba, restrictions, travel restrictions, those kind of things. And then I want to say as well that when it comes to our district-based reporting system, Manitobans know that we've been reporting on more than 60 individual districts in Manitoba, allowing us to put the measures and restrictions where they're needed. I want to update all Manitobans and indicate that Public Health has indicated they support that same district-based reporting system to be applied to Winnipeg as well. So we will indicate now in this space that we will be moving to provide more specificity when it comes to Winnipeg, 12 areas that will be identified, and we would hope to have those changes done and available for Manitobans before the end of the week. That's the target that we have. So without further ado, over to Dr. Brent Roussin.
No, thanks, Minister. Our current 5-day test positivity rate is 1.3%. We have 11 new cases of COVID-19 to report as of this morning, bringing our total cases in Manitoba to 1,349. There's one case in Interlake Eastern Health Region, 2 cases in Southern Health, and 8 cases in Winnipeg Health Region. There are 393 active cases and 940 individuals listed as recovered. 13 individuals in hospital, 3 of which are in intensive care, and the number of COVID deaths remains at 16. As far as testing goes, an additional 1,219 tests were completed on Monday, and this brings our total number of tests completed to 148,537. Going to provide some updates on our current clusters. So there has been a total of 457 cases in Prairie Mountain Health Region since July 1. Currently 214 active cases. Over the last 2 weeks, there has been a clear decline in the daily case counts in Prairie Mountain Health. A total of 86 cases are linked to a business in Brandon, 38 of which are active. 20 of those cases have links to both the PMH cluster and business in Brandon. There are a total of 317 cases related to communal living situations, with 89 of them being active. The Bethesda Place outbreak in Steinbach remains at 13. The Assiniboine Center outbreak at the Brandon Regional Health Center now has a total of 10 cases, 3 staff and 7 inpatients. Fairview outbreak in Brandon now has a total of 3 cases, all in staff members. Hillcrest Place outbreak in Brandon continues to have a total of 4 cases, 2 in staff and 2 in residents. Rideau Place outbreak in Brandon now has a total of 2 cases, both in staff members. Fred Douglas Lodge in Winnipeg continues to have just 1 case of a staff member. Beacon Hill Lodge outbreak in Winnipeg has a total of 2 cases, both in staff members. Concordia Place Personal Care Home has a total of 1 confirmed case in a staff member. Donwood Group Elderly Persons Housing has a total of 1 confirmed case in a resident. As mentioned, we are attempting by the end of the week to break down the Winnipeg cases by community area. There'll be 12 of those. And information will be presented much like the health districts. Data regarding active and recovered cases, deaths, and total cases will be available. We're making this available to provide that more information for Manitobans about COVID-19. And certainly it will be available on our website, manitoba.ca/COVID-19. We again talk about the need for the fundamentals. We've had an increase in cases we've seen with this recent wave in August. We're well versed in those fundamentals, washing our hands frequently, staying home when we're ill, even if mildly ill, physically distancing whenever possible, wearing a mask in indoor public places, especially when you can't physically distance. We want Manitobans to isolate as soon as symptoms develop, even if they're mild. Go for testing as soon as symptoms develop. We've still seen in a number of recent cases quite a delay between the onset of symptoms and the attending for testing. The sooner we have cases identified, the sooner we can do contact investigations, the sooner we can have people self-isolating. Again, employers are encouraged to work with employees to ease the burden of staying home while ill. We don't want to make it difficult for people to stay home when they're ill. We only want Manitobans who are experiencing symptoms to attend for testing, unless, of course, you've been advised by a health provider to get tested. This applies to employers. Please don't send asymptomatic employees for testing as part of your work program. We need to reserve our testing for symptomatic individuals at this point. There have been individuals who are, there's questions regarding self-isolation protocols for people without symptoms who have been tested as part of sentinel surveillance. These people should just self-monitor for symptoms. They're not required to self-isolate. People who are required to self-isolate will be informed by public health on the need to do so. Doctor's notes, we're still getting a lot of questions regarding doctor's notes and the need for notes to return to school or to return to work or extracurricular activities such as sports. Public health guidelines do not require physicians' notes. So public health will advise those individuals when they can return to work, school, or daily activities. Notes are not necessary or advised. And our last note again on stigma, that stigma will impair our ability to investigate cases and follow up with contacts, so please be kind. Know we're all going through this together. Use credible information when making decisions, and you can find that at manitoba.ca/COVID-19. So thanks, we can open up for questions.
The epidemiological report that's up here today lists 25 cases were associated with a healthcare facility in WRHA. Correct to assume that's the HSC?
That is, that was that one outbreak there, I believe, yeah.
You said there were 2 deaths associated with that. Which death numbers were those? And is it correct to assume that they were infected in hospital?
That was a little while ago when that occurred, so I don't have that information. We can look into that, yeah.
A little while ago when it occurred, but at the time we asked repeated questions because I know it myself, Diana at OB, we asked repeated questions and we knew that one of the cases their family was saying off the record they were infected in hospital. They were shut in for years. How come it's taken since April to now to disclose that there were 2 deaths of people who were infected in hospital?
Well, I mean, I think that the reporting has been all along this is quite separate than the public health work, right? Like the public health work gets done even as we speak now. There are cases being reported. People are investigating them. Reporting is just another aspect of it.
And I'll let you off the hook and ask the minister why it's taken Manitoba 5 months to disclose that 2 people who died as a result of a HSC outbreak died.
So I have no specific information on the issue that you're raising today and happy to look into it.
Does it bother you that it's taken 5 months to tell the public that 2 people died from a
I think
hospital?
that the record of our government on COVID-19 has been remarkable in terms of the commitment that we made to Manitobans to put good information in their hands, to build structures that would give Manitobans that good information. Bartley, look, we've got a system in Manitoba right now where we're reporting on 80 districts by Friday to give people instant information on where those cases are taking place. So we believe that we're doing well, and we believe there's always room for improvement, and happy to look at it.
And one more on this report, there was an outbreak with 24 people and 1 death at a Winnipeg workplace back in March and April. Do we know what workplace that is?
Yeah, well, we've disclosed names of those things if there was a public exposure to it. So if it wasn't disclosed because there wasn't a need for the public to take action.
We can impute Maple Leaf from the Brandon one because of Maple Leaf's own proactive disclosure, but I'm racking my brain here. Any help?
Well, I would want to make clear from our point of view that we accept the advice of public health officials. And so our chief has been clear in Manitoba that when there is a value in actually declaring what the name of a business is or more information, that has been done. When we felt that there was a public health interest, we accept the advice of the public health officer when it comes to those matters.
If there are, 24 cases related to a business, whether that business may be public facing or not, should the public not be told that there's quite a cluster linked to this one location?
Yeah, well, I think speaking about clusters, which we do, naming an individual place doesn't really provide much benefit, because if there's no exposures to the public, then it's not limiting anyone's exposure. Certainly people involved in that, right? Employees at that are heavily notified. Often asymptomatic testing goes on as part of a cluster. And so there's lots of involvement for the people who are required to know. Otherwise, a public announcement doesn't benefit.
So this business, whatever it was, is completely sealed off from any sort of front-facing public interaction?
Right.
Dr. Roussin, you've talked about not naming districts or neighborhoods of Winnipeg because it might not be helpful. It could be, somebody who lives in North Winnipeg, works in South Winnipeg, and has family in West Winnipeg. So, saying that the cases are in one particular neighborhood is not going to help because people could have roamed all over the place. So why now break it down into districts? What changed your mind?
Yeah, so it's certainly not to be able to guide people's actions, because like you say, if we see one community area that has a preponderance of cases, it doesn't mean that's where the cases were acquired. It doesn't mean that you can pay less attention to the fundamentals in other areas. So it's not to guide action, it's just to provide that information. I think Manitobans have repeatedly said they want more information, and so this is just another step in that direction.
The cases that are cropping up lately in Winnipeg, new cases are dropping, but there's still a significant number on a daily basis. Have you noticed any difference in the source of transmission in these numbers? Are we seeing a higher percentage in recent cases of community transmission, less in travel? Has that changed at all?
Yeah, so we're still seeing the vast majority of cases are close contact with known cases. And then we're seeing that in Winnipeg, we're about that 20% non-EpiLink cases. And so we have 16 non-EpiLink cases in Winnipeg in the last 7 days.
And has that been a fairly standard percentage?
Yeah, in this what we call, if we call this a second wave or the August wave, then yes, it's been about 1 in 5 cases in all the regions have been non-EpiLinked.
And close contact numbers are up. Is that because people are having more contacts and not staying home as much?
The average amount of contacts per case has steadily increased.
The source of the outbreaks at the personal care homes have been largely tied to staff bringing it into the homes. So is there any monitoring or inspection going on to make sure that the homes are following the protocols and the universal PPE guidelines?
Yeah, so there was, there's a lot of work throughout the pandemic on this, and a lot of challenges, but seeing these increased numbers of outbreaks, everyone had to sort of double down on the importance of that. So there's going to be more efforts in screening, more efforts in watching that PPE use, more messaging.
And were they infectious, asymptomatic, or pre-symptomatic? If they were asymptomatic and infectious, wouldn't that indicate that it'd be a good time to start doing testing of people who work in personal care homes just to see?
Well, when there's an outbreak, we'll do that, do a lot of testing. But somebody who's asymptomatic often will be negative. They'll give you that false test, falsely negative test. So asymptomatic testing isn't of great value. Screening for symptoms, that universal PPE, that combined will limit the impacts.
And just about the Manitoba Junior Hockey League, is there any consideration being given to making it an essential service or business so that the league can continue? So, because one of the teams is north of the 53rd parallel, so OCM Blizzard, can they have teams come to play there and go back and forth? Is that something you're looking at?
Yeah, actually, we just amended the northern travel order today to allow that sports teams could travel.
And why is that a good idea? I'm just thinking people are worried about all the cases in the south, and I know you've been, closely connected with Indigenous communities and in the north worried about this, so.
Yeah, I mean, it's part of that balance, right? It's like we want to ensure we're protecting the remote isolated communities from the virus, but we've allowed for a number of exemptions for all sorts of activities, and this is yet another one that we felt had a lot of benefit to it and lower risk.
Doctor, according to the weekly COVID report, which is not the epidemiological report I was talking about earlier, 8 more healthcare workers have been infected with COVID-19. How concerning is this to you? What do you make of it?
Yeah, I think it's along what we were talking about on getting ensuring that all steps are necessary. So it's concerning. We don't know if the acquisition of those, whether they acquired it in a healthcare setting. We know some of these in our clusters that we just announced, some of those are tied to the workplace. Others would be acquired outside the workplace, but just reinforces the need to ensure we're screening daily for symptoms and that PPE, where appropriate, is always used.
And it's interesting that you guys are disclosing for the first time how many contacts the patients have had. Thank you for that information. What do we make for the fact that people in our Lake Eastern had a lot more close contacts? Are we looking at communal living situations, or?
It sure can be related to that. We know we've had a number of cases in communal living situations. Just overall, since we've been reopening and this wave that's in the summer here, we know that the average number of cases or contact per case has increased, which is telling us that we're losing some track of those fundamentals.
So with the 2 deaths at Bethesda last week reported, and the 2 deaths at the Winnipeg Healthcare Facility, which is the HSC, and then we had 1 death in a personal care home in Winnipeg earlier this year. Does it mean that 5 of our 16 deaths so far are related to healthcare facility outbreaks?
So there was 4 deaths at Bethesda?
4 at Bethesda, pardon me, I've forgotten. 2 at HSC, that's 6, and then 1 at another facility in Winnipeg. I believe it was a Rivera, I might be wrong, just memory here. So that's 4 and 2. 7 out of our 16 fatalities are care home outbreak, or healthcare facility outbreaks?
Are related to healthcare, yes.
Is that correct? 7? And which was the care home? Do you recall offhand? The other one?
Poseidon, I believe.
Poseidon,
was,
thank
yeah.
you. So can you just commit to, I know you don't have it immediately, but can you commit to providing follow-up information on the 2 people who died related to the HSC, how they were infected and which death numbers there were?
Yes.
Thank you very much.
Okay, perhaps we'll take this opportunity to go to the phone. First up from CTV, Jeff.
Hello, Dr. Roussin, Mr. Friesen, Jeff from CTV. I'm just wondering, today the Education Minister said, we need to be more transparent. They want to be transparent about COVID numbers. When it comes to schools, how, transparent are we going to be publicly? Are you going to be releasing publicly right down to the classroom or the cohort? When there's an outbreak in a school or a case, how will that be reported? Down to what minuscule area?
Yeah, so with a case in school, and we certainly have to expect that, right? We've seen cases in kids when they weren't in school, So we have to expect to see cases in schools. So if we see that, we'll be working our way from the inside out. So we'll certainly notify the case and then do a thorough contact investigation and notify everyone who needs to self-isolate for 14 days. That could be a subsect of the cohort, or it could be an entire cohort. But we'll be informing those people first. Then we'll be informing the school community that there's been a case. And then we're going to be posting it on our pandemic response system that school has had a case. And we're going to name the school and do what we can to name the cohort, whether that's by grade or another identifier.
Okay, thank you for that. And it just kind of a follow-up to, I think, what Steve was asking about Winnipeg. I think you said 20% was the potential community transmission. Is that concerning, Dr. Roussin? Because prior to when we shut down and we were just starting to open up, I think community transmission was pretty low in the province, but we're starting to see more numbers in Winnipeg. Yeah, they're down today, which is good, but are you concerned about any of these, in the cases that could be community transmission?
Well, I think we're concerned about the pandemic and including these community-based cases. Like we say, usually if we have a case that's a known contact, then they themselves are not going to have very many contacts because they've been self-isolating. So a community-acquired case will typically have many more contacts than a person who is a known contact. So those are concerning to us. We have seen that tick up, but we haven't seen a consistent rise in it. It's been staying about that 20% in our regions. During our first wave, the early months, the non-EpiLink cases, the community-based transmission was about 12%. We're now seeing overall that's around 16-17%. And then in Winnipeg, it's about 1 in 5.
From City News, Jonas.
Good afternoon, gentlemen. A question for Dr. Roussin on Prairie Mountain. For the first time today, it appears no new cases. Just maybe an anecdote on what's happening in Brandon area with the clusters and where we are right now.
Yeah, so we're certainly seeing the trend in the right direction with case numbers in Prairie Mountain Health. And so we'll be watching that closely. We're just sort of at the tail end of the first incubation period after we went to restricted orange in Prairie Mountain Health. So we'll continue to watch those numbers closely and adjust the pandemic response system as indicated.
And this trend in Prairie Mountain's been going down for a little while. The clusters specifically, I guess what's the status there?
Sorry, I didn't catch that last point.
Just focusing on the clusters specifically, and the cases have appeared to be going down lately. Has this outbreak been contained, or are you confident on where that is right now?
Well, it's early on, so it's an early trend, but certainly this trend is moving in the right direction. And we have those restrictions in place now. We have the use of masks mandated right now. So we're going to continue to follow it. Certainly the trend is in the right direction, but it's really early on.
From the Brandon Sun, Michelle.
Yes, hi, Dr. Roussin. I'm hoping you can indulge me today. I guess part of my motivation for asking this question is to remind people about the answer that you might give me. So I was looking at flu death numbers from the past few years in Manitoba, and I'm hoping you can refresh our memories on how COVID-19 is actually different than the normal flu seasons that occur.
Mm-hmm. Yeah, and so we're still, we've learned a lot about this virus, certainly learning more about it. Over time, over the first bit of this pandemic, we've seen the case fatality rate of COVID-19 being roughly 2%. Certainly the most at risk are those in the older cohorts, those over age 65, those with underlying health conditions. Typical influenza season, we estimate the case fatality rate to be about 0.1%. And so if you look at, say, compared to last year's flu numbers, we had, during last year's flu season, we had 403 hospital admissions reported related to flu, and 29 deaths related to flu, and 40 ICU admissions reported as flu. And then so you'll see, but from the beginning of this pandemic, our numbers, we've had, a total of 84 admissions related to COVID-19 and 27 ICU admissions related to COVID-19. So now we've achieved that with many, many restrictions and many, many processes in place. But now coming to a respiratory virus season, it's very likely we're going to see the co-circulation of those viruses along with the other viruses we see at that time. So we'll have to monitor it very closely and ensure we're not putting additional strains on the healthcare system.
Okay, thank you very much. I'm good.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Just kind of following up on some questions asked earlier with respect to the Prairie Mountain Health Region still being restricted. Obviously, we're seeing lower numbers of new cases in that area lately. No new cases today, which by my count is the first time in more than a month at this point. What do you make of the kind of trend so far, and what would prompt you to pull the region back into the caution level? What would you have to kind of see for that to happen?
Yeah, and so certainly the trend is looking in the right direction right now, and so we're going to continue to look at that. It's a bit of the timing as well. So we're just into one incubation period since we put the restrictions on, and so we need to see more of this trend for much longer. For perhaps another incubation period, or at least another half incubation period before we could think about wanting to lift those restrictions.
And I know we're seeing today that IKEA in Winnipeg is closed because an employee there tested positive. Are you aware the last time the employee worked there?
No, I don't have the specific details on that. I do know that that public health did not advise to shut down. So I think there's a lot of companies that are paying very close attention, very concerned about Manitobans, and taking some additional efforts going above and beyond what public health would suggest. But in this circumstance, we did not advise that was necessary. But as we've seen, a lot of Manitobans go above and beyond what they need to do.
From the Winnipeg Sun, Scott.
A question for Dr. Roussin today. If the mask mandate is working in the Prairie Mountain Health Region, and we're looking to get numbers down here in Winnipeg as well, why not just put that in place here in Winnipeg to try and kind of replicate the same effect?
Yeah, and so we're always looking at these interventions, and we've spoke about increasing mask messaging and increasing mask use for sure, and that a mandate to that, whether it's going to be at a provincial level or targeted at a regional level, is always on the table. Remember, we're just one incubation period since we've made those measures in place in Prairie Mountain Health, so we can't really conclude a whole bunch about that. But certainly we're looking at that, and none of these options are off the table.
And as public health, so there's been a lot of people who have recovered. There's been many months and some have recovered. Has public health been tracking any long-term effects that COVID has had on people who have been deemed to be recovered but have maybe experienced, lingering whatever effects that it might have taken on the body? And if so, is there any of those that have, that you can speak of at this point?
So no, public health isn't performing any surveillance on recovered cases at this point. Any of that would be done clinically, but it's not a reportable requirement. So physicians wouldn't be reporting that to us.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. Gavin from Radio Canada here. We just saw a case, I think, this weekend in northern Manitoba. And right now it says on the website that it doesn't indicate which health region that case is in. But I saw the city of Flin Flon put out
a release saying there was a case found in Flin Flon. I was just wondering if you could clarify which area of northern Manitoba this case was in.
Yeah, that is the district. I'm not sure the name of that district, but it should be reported on the site. So this is a typical case investigation, contact investigation, and there wasn't really any concerning contacts that we had to make a public announcement about.
Do you have any information on how the person got the virus? Did they travel down south? Or?
I don't have any specifics about that case.
Thank you, Doctor. We now return to room 68.
When you start releasing districts details within Winnipeg, they'll be based, just so I understand correctly, they'll show where people live, not where they might have got the virus.
That's correct, yeah. So it's the address on their health card that they have when they test positive. So it'll show just that. So that's why it's not a lot of information to, so public health wouldn't be instituting any restrictions based on a community area. That just wouldn't really make sense to do it that way. But just providing Manitobans a lot of the information that they're looking for. But yeah, it sure doesn't say where or if they acquired it in Winnipeg or how. So it's just their addresses.
Will this include all the cases from going back to the beginning of the pandemic or starting Friday?
Yeah, we'll have total cases and active cases. And then we'll be working on in our districts to have the incidence rates applied there, just because sometimes the total cases can be misleading. Certain areas might have a lot higher population.
Thank you for that, Doctor. That's going to be much appreciated. I know you've answered this many times over the last few weeks, but parents are paying more attention today than any day. So if you'll indulge me, parents are confused about the mask wearing sometimes, some of them. What if kids are wearing masks, why do they still need to stay 2 meters apart?
Yeah, from the beginning, what we've said is that mask use is an additional step. So right now, we want those fundamentals, hand hygiene, distancing, staying home when you're ill, and on top of that, we're going to add mask use. We know that especially with children, well, with adults for 8 hours, adherence to proper mask use is going to be challenging. And so we don't want to just rely on the mask use. We want to have it as an additional factor to all the other fundamentals we have in place.
Minister Friesen, can you give us an update on what's happening with the auxiliary visiting areas for personal care homes now that it's getting cold and there's outbreaks?
Yeah, I can give you an update on our co-visitation strategy. As we said, proceeding on 2 rails, the one being shelters that could be put up outside adjacent to personal care homes and connected. And the second set of those would be personal care homes at which there is some kind of space delineated and carefully and safely built within the structure. I can tell you that the award was made a couple of weeks ago to the principal that will create the exterior spaces. Work is continuing rapidly on the interior spaces. We have put a lot of work into making sure that there is emphasis placed on delivery on time. As I've said in this room before, this won't help us a great deal if they show up on site in April or March. We have to make sure that these are here for the purpose of allowing visitation to take place between residents and their loved ones and their caregivers. So to our knowledge, there aren't a lot of provinces who are into this kind of area of focus, but we felt it was incredibly important. I believe that we're going to be providing an update quite soon in terms of letting the media and Manitobans see what we're doing, what we're building, and what our plan consists of to make sure that these things get installed in time.
When's on time? What's the...
What we said was that in the RFP that delivery had to begin in early fall, and we were looking for the vast majority of delivery to take place by late fall.
So on a similar note, Dr. Roussin, some vaguely similar note, some restaurants are going to hope to extend their patio seasons this year with the use of heaters. In other markets that have done a lot more of this winter heating, they've put up some sheeting, plastic walls. It's not really outdoors. What specific, will you be providing specific guidance to restaurants or other businesses that are going to attempt to put up patios this fall and winter?
Yeah, I think it'd be something that we're going to need to be clear about. And so when we talk about a patio and that, we expect it to be just that, a predominance of outdoor air, so not enclosed. So right now, I mean, we're still at the distancing for restaurants is the 2-meter distancing between tables, and that's inside or on the patio. So there's not a huge distinction right now. But as we move into flu season and respiratory virus season, there's always the possibility of restrictions on the pandemic response system. But yeah, well, if that becomes an issue, we'll certainly have to clarify.
Has a city bylaw or planning people come to you folks yet and said, what's acceptable?
Not that I know of, no.
And with the districts for Winnipeg, just getting back to that about stigma, and, if it really isn't giving us a lot of useful information, won't that just lead people to jump to conclusions about neighborhoods or areas? Is that a concern? And
Well, stigma is always a concern to us. We know that it challenges our ability to fight the pandemic. But all of it, all the information we release is always that balance, right? And so we started talking about communal living situations, and it's a balance that risks stigmatizing people, but it also is might be misleading to Manitobans when at one point almost half of our active cases were related to that. So it's a balance on what information is Manitobans want and the risk of stigma. But that's why we continue to message that stigma is going to hurt all of our ability to deal with this pandemic.
what about with the COVID app? There's no stigma because there's no, you don't know the neighborhood, the name, you just know if you've been in touch with them. Is that any closer to happening here in Manitoba?
Yeah, we're still working on that, and again, I think that's going to be a good addition to our pandemic response. It's certainly not going to replace contact tracing. The most important aspect of this contact case identification, contact tracing is still going to be done by public health. This is just something that's in addition to that.
So what's the holdup? People are asking, why don't we have this yet? Why isn't it in place?
Well, I think there's a lot of issues that you have to, make it work for your province. Have to get a number of things in, all the technological issues in place. So I've been in contact with our group that's leading this and trying to look at ways to implement it. But I think we're on par with many other provinces to try to get this on in Manitoba.
Thanks, everyone.
Thank you very much. Thanks for the Winnipeg breakdown, that's awesome.
Coming your way.